Hi, today we will now be discussing marijuana. But first, we need to know what marijuana is. Marijuana refers to the dried leaves, stem, flowers, and roots of the plant Cannabis sativa and Cannabis indica. It contains mind-altering chemical, THC, and other similar compound, and it is most commonly used psychotropic drug in the world after alcohol. However, marijuana contains medical use in the medicine world, termed medical marijuana. So, what is medical marijuana? The term medical marijuana refers to the use of unprocessed marijuana plant and its basic extract to treat symptoms of illness and other condition. Scientific study shows that marijuana produces a chemical called cannabinoids that has led to 2 FDA approved medication. So, the question is, can marijuana be approved in a medical approach or it will remain as a psychotropic drug? And that will be answered by our interviewee led by Mr. Ignacio and Mr. Tarrobal.
Hi guys, I'm Ramon Ignacio. Me and my partner, Mr. Tarrobal, is here to ask or to interview some people about our topic, which is medical marijuana. So we have 5 questions per interviewee. First question is, are you a pro or non-pro on medical marijuana and why? Second question, do you think that it could be really used to cure sickness? And third question, if you were the president of the country, would you recommend legalizing it in your country? Fourth question, if you are a pro on medical marijuana, would you allow minors to use the medical marijuana and why? So last question is, are you willing to use medical marijuana for any sickness?
I am Inigo, from CSB also, and ID number 1, ID 116. So for question 1, I am a pro. Because in my opinion, medical marijuana could be used as a cure for sicknesses such as cancer and other deadly diseases. And for question number 2, yeah, again, I really think it could be used as a cure for sickness. And for question number 3, if I think I would legalize it because again, I think it could be used as a cure to sicknesses and diseases. And for minors to use medical marijuana, I think it is a situational option, meaning if it is being prescribed by the doctor or any other medical personnel, I believe that they could be able to use medical marijuana. So,
Hi, I'm Danis Abu. I'm 19 years old from Ateneo de Manila. First question is, are you a pro or non-pro on medical marijuana and why? Personally, I support the use of medical marijuana. I have read articles and various studies online that its use actually eases the pain and the experiences of those people who have or are suffering from chronic diseases such as PTSD, epilepsy, and those who are undergoing chemotherapy for cancer. I think there's a lot more. Second question is, do you think that it could be really used to cure sickness? Well, I'm no medical expert. I'm not well versed in medicine, but I think potentially maybe. I read articles that says that there's a lot of studies and researches that has to be conducted to prove that it does cure diseases. But because as of now, what is proven is that it eases the pain and the condition of the patients, but not entirely or totally cure the disease. Next, if you were the president of the country, would you recommend legalizing it in your country? If its benefits is clinically proven, why not? I mean, these people have suffered so much and enough, and if we have or if there's a way we can do to alleviate such alleviate such pain from them or help them cope up with such conditions, then why not do it? However, if we would allow such activity, then first of all, before anything, what we have to do is to craft strict rules and guidelines that will counter the possibility of drug abuse. Because again, we are handling a very addictive drug here. Fourth, if you're a pro on medical marijuana, would you allow minors to use medical marijuana? Yes. But again, like everybody else, there's no exemption, whatever age, whatever social status, or whatever condition. We have to make sure that its use is strictly for medical purposes. So its use has to be restricted. 5, are you willing to use medical marijuana for any sickness? Yes, I am willing to use medical marijuana only if the need arises. Again, not for any sickness.
My name is Maria Clarissa Carlos from University of Santo Tomas. I am a pro on medical marijuana because it has a lot of health benefits, especially towards to those who have cancer, AIDS, and anorexia. Question number 2. I don't think it is used to cure any sickness. Rather, it is used to ease pain and boost immune response. Question number 3. If I was the president of the Philippines, I wouldn't recommend using or legalizing marijuana because our country is facing a problem right now, which is the abusive use of drugs. Question number 4. I would allow minors to use medical marijuana, but in certain conditions, such as if they have medical prescriptions and proper guidance. Are you willing to use medical marijuana? Yes, I am willing to use medical marijuana.
Are you a pro or non-pro on medical marijuana and why? So, on my opinion, I am pro medical marijuana because as I've read in some researches and in some studies, marijuana really helps people relieve anxiety and depression, and for me, that is a big help in our society since there is a great amount of people who have mental illness in our generation today. And if we would legalize marijuana, then we would be helping people with mental illnesses to feel better and maybe even save a life. So next, do you think that it could be really used to cure sickness? Yes, I believe that it could really be used in treating illnesses, but it should be used only in moderation. I believe that it can cure some illnesses because, as I've said, I have already read researches on how successful medical marijuana is to other people, and it is also already used in other countries. That is why we have proof that medical marijuana is really helpful and relevant to the illnesses that is happening in our society today. So next question. If you were the president of the country, would you recommend legalizing it in your country? If I was the president of the Philippines, I would recommend legalizing marijuana in the Philippines, but only for medicinal purposes. Some people use it recreationally, and I think, for me personally, I think in moderation it's okay. As long as you know your limits, then nothing bad will happen. And for me, it should really be legalized medically because it really helps people with anxiety, and it really helps treat patients in terms of mental illnesses, and also some of the researches that I have read indicates that it helps cure cancer. And for me, I think it is a big step in fighting those diseases if we legalize it in our country. And if I was the president, I would legalize it because it would help a big community in our society to be well. If you're a pro on medical marijuana, would you allow minors to use medical marijuana? For me, I would allow minors to use medical marijuana if they have prescriptions or diagnosis from the doctors that they are really in need of that medicine. I think it would best be used by the teenagers that have anxiety and depression because it helps really relieve and relax the mind. As long as they have prescriptions and diagnosis, then I think there is nothing wrong with teenagers using medical marijuana.
Are you a pro or non-pro on medical marijuana, and why?
This depends on the situation. If you're going to use it to relieve the pain of the sick, why not? Why not?
Do you think that it could be really used to cure sickness?
I think it can only be used as pain reliever and not really a cure.
Okay. If you were the president of the country, would you recommend legalizing medical marijuana?
No, I will not recommend to legalize it because, as you can see, the effect of it to individuals using it often can make the brain and can be brought to make a person violent.
If you are a pro on medical marijuana, would you allow minors to use
No,
this?
definitely not.
Okay. Are you willing to use medical marijuana for any types of sickness or medication?
Yes, with strict implementation and supervision, I will.
Okay, thank you. Are you a pro or non-pro on medical marijuana, and why?
I'm for medical marijuana because a lot of scientific studies show that it can help with terms of pain with the patient.
Okay. Do you think that it could be really used to cure sickness?
Really used to cure sickness.
Hmm.
It can't be used to cure sickness for me, but it does help the patient, but it doesn't take away any sort of sickness.
If you were the president of the country, would you recommend legalizing medical marijuana?
Philippines?
Yes.
Yes, I would recommend it, but it's difficult to legalize something that big in the Philippines, especially since we are a predominantly Catholic country. So it won't bode well for the people, even if there's so much positive feedback when using medical marijuana.
If you are a pro on medical marijuana, would you allow minors to use medical marijuana?
For medical purposes, right?
Minors.
Minors?
Mm.
Yeah, with strict implementation.
Okay. Lastly, are you willing to use medical marijuana for any types of sickness or medication?
Yes.
Okay. Thank you. Are you a pro or non-pro on medical marijuana, and why?
If it's medical marijuana, then yes, I am a pro. Because we're talking about medical marijuana, right? It would be used for medical purposes. We're not talking about the recreational marijuana that tend to be abused by others. So yes, I am pro. I am a pro in using medical marijuana.
Do you think that it could be really used to cure sickness?
Well, certain studies have shown that it could be really of great help in treating anxiety and PTSD, the post-traumatic stress syndrome. Post-traumatic stress disease, PTSD. So yes, it could be beneficial.
If you were the president of the country, would you recommend legalizing medical marijuana?
I would say yes, but with strict implementation of who could prescribe it, like the correct physician, and who could purchase it.
If you are a pro on medical marijuana, would you allow minors to use this drug, or also known as medical marijuana?
Well, there has been an upsurge in the suicide rate of youth today. So if medical marijuana could help in the alleviation of depression and anxiety-related disorders, then yes. But if we're talking about minors, there should be deeper studies on the delivery methods and the correct dosage that should be used in every age group, in every person.
Lastly, are you willing to use medical marijuana for any types of sickness or any types of medication?
If it would be of great help and it would be beneficial to the patient, or if I needed it, yes.
Okay. Thank you.
There are records of medical cannabis use in China from nearly 5,000 years ago, and their use of hemp stalks and seeds dates back even further. While some have viewed cannabis negatively over the last century, after several successful campaigns to paint the plant in a negative light and subsequent prohibition, opinions have been shifting over the past few years as more countries, including Canada, legalize cannabis. But is cannabis use actually safe, and does it offer any medical benefits? Current data indicate that cannabis works by interacting with complex systems in the body called the endocannabinoid system, or the ECS. Cannabinoids are active compounds found in cannabis, which have effects in the body. Endocannabinoids are cannabinoids that our bodies naturally produce. Although we don't have adequate research on the ECS, scientists theorize that the body produces substances that stimulate its cannabinoid receptors, which are located in the brain, muscles, fat, and digestive tract. The ECS helps our bodies regulate pain, mood, appetite, motility in the gut, memory, emotions, stress response, immune function, and more. When a person ingests the plant-based cannabinoids in cannabis, such as THC and or CBD, which are similar molecular shapes to endocannabinoids, they fit into the same receptors and trigger reactions that result in either very high or very low levels of specific neurotransmitters, which the cells of the nervous system, as well as other systems in the body, use to communicate with each other. THC is the psychoactive component that causes individuals to feel high when they consume cannabis, but it offers useful medical effects, such as pain relief. CBD also has medical benefits, such as reducing seizures and inflammation, but it does not contribute to the intoxicating effects of cannabis. Each strain of cannabis has a specific THC to CBD ratio, and successful treatment means getting this ratio right for the individual. The functioning or lack of functioning of the ECS might have an important relationship to the pathology of chronic conditions and could be tied to the efficacy of cannabis products. Conditions that might be improved by cannabis use include inflammatory bowel disease, multiple sclerosis, neuropathic pain, chemotherapy-related nausea and vomiting, pediatric seizure disorder, and a wide variety of other illnesses. Patients who have tried numerous medications without getting adequate symptom relief are hopeful that cannabis will work for them. While many patients claim cannabis reduces their gastrointestinal symptoms, there is little clinical research to date. Part of this is related to the illegal state of cannabis and past stigmatization. So, researchers in many countries face legal barriers studying its medical effects on humans. Other difficulties in conducting good clinical trials are the relative inability to blind the subjects from knowing which treatment is placebo and which is the active therapy, and that the symptoms being measured are often subjective. However, evidence is building, and we hope to see more studies as legalization of cannabis increases across the globe. So far, research shows that cannabis is effective for managing some types of chronic pain, including abdominal, and is useful for reducing diarrhea, nausea, poor appetite, and weight loss. Some studies show that cannabis might be an effective alternative to opioid medications with fewer side effects. Population studies on those with inflammation.
Our world is now suffering on a pandemic called COVID-19 or coronavirus 2019. So I would like to remind you guys to two things that will save your life. First, you need to wash your hand. Second, please stay home and be safe. Thank you guys and God bless.
Stay safe on the ongoing pandemic and stay vigilant and hydrated.